Premature infants, which is a birth less than 36 weeks gestation, are at risk for complications associated with anemia and may require blood transfusions. They are also at risk for intraventricular hemorrhage or brain bleed. Immediate cord clamping, which is the cord clamping within the first 30 seconds of birth, became widely practiced in the latter part of the 20th century for analgesic use in controlling mother's pain during labor. This information was obtained in the Obstetrical and Gynecological Survey of 2016. The timing of the umbilical cord being clamped affects the newborn's circulatory system, shifting from an open, low-pressure system, which is entirely dependent on the mother and the placenta, to a closed, high-pressure, self-sustaining system. What if I told you that delayed cord clamping for 30 to 60 seconds with the infant maintained at or below the level of the placenta can benefit the neonate by increasing blood volume, in turn reducing the need for blood transfusions and decreasing the risk of intraventricular hemorrhage in the preterm infant? Cord clamping is the process of clamping the umbilical cord after birth by placing one clamp at the umbilical cord closest to the neonate and one clamp closest to the placenta to prevent maternal and or neonatal hemorrhage. The World Health Organization Reproductive Health Library in Geneva wrote that the process for delayed cord clamping, DCC, is to clamp the cord 30 to 60 seconds and up to 5 minutes after birth and position the infant at or below the placenta to allow for placental or autologous cord blood transfusions. Research suggests delayed cord clamping benefits a preterm infant because it reduces the need for PRBC or blood transfusions and decreases incidences of intraventricular hemorrhage. Today, I will discuss two main points regarding delayed cord clamping. First, research shows that delayed cord clamping reduces the need for PRBC transfusions. And second, randomized studies show DCC decreases the incidences of intraventricular hemorrhage. The definition of anemia, according to the Mayo Clinic, is defined as a condition in which you do not have enough healthy red blood cells to carry adequate oxygen to the body's tissues. A preterm infant is at risk for anemia because of slow production of mature red blood cells just by the nature of the preterm infant's organs being immature. The preterm infant is also at risk for infection, which could cause anemia. And lastly, the preterm infant requires frequent blood draws to coordinate care while in the intensive care. Anemia has been shown to hinder growth and interfere with the recovery of certain diseases and or infections prone to prematurity. This is based on research done by Siriani Serdejas, 2006. My first point is that there are benefits of delayed cord clamping with respect to anemia of the preterm. By delaying cord clamping, the preterm infant is transfused via the placenta, increasing blood volume and red blood cell count significantly and as much as up to 10 weeks after delivery. It has also shown increased ferritin levels all the way up through 6 months of age. Benefits of delayed umbilical cord clamping include the reduced need for blood transfusions, for low blood pressure, and anemia, and studies have shown that infants' mean blood volume is significantly greater in the DCC than it is in the ICC, or immediate cord clamping. And this is according to the Aldegani study of 2006. Now I'd like to talk to you a little bit about how the DCC, delayed cord clamping, can reduce the risk for intraventricular hemorrhage. According to the U.S. National Library of Medicine, IVH, intraventricular hemorrhage, is defined as bleeding into the ventricles inside the brain. And there is a direct correlation between low blood pressure and IVH, also stated by the U.S. National Library of Medicine and National Institute of Health of 2015. A preterm infant is at higher risk due to the risk of unstable blood pressures. Hypotension is associated with increased mortality and IVH in the preterm infant. Improving the infant's initial cardiovascular function helps with these complications. And this is stated by an article in the American Academy of Pediatrics in 2006. Benefits of DCC with respect to IVH are on multiple studies have shown that delayed cord clamping increases initial blood pressure, therefore protecting the infant and significantly decreasing the incidences of IVH by nearly 50%. This information was obtained by the American Congress of Obstetricians and Gynecologists through 2012 and Obstetrical and Gynecological Survey of 2016. Let's turn our attention to the table. This was a randomized controlled trial done by the University of Rhode Island and Brown Medical School showing the results in 2006 that a preterm infant in the DCC group had less IVH, 14%, versus the 36% of the immediate cord clamping. In conclusion, delayed cord clamping benefits the premature infant by increasing hemoglobin levels, increasing blood volume, and increasing blood pressures, therefore decreasing the need for blood transfusions, as well as decreasing the incidences of IVH. The American College of Obstetricians and Gynecologists support delayed cord clamping in the preterm infant and has determined it to be safe and effective. By holding off cord clamping an extra 30 to 60 seconds, we have the opportunity to help give these preterm infants the best possible start. Thank you.